Hello everyone, David Wilson here from Dr. Stem Cells, and in today's video we're looking at the use of regenerative medicine in cosmetics to try and see if we have any hope for future treatments without needing surgical intervention and how it lines up with the rest of the current offerings. Cosmetic treatments can largely be grouped into the following steps. The first step is to go to someone who provides a topical lotion or ointment, someone who provides makeup or beautician services, because those can have some effect on the skin to help feel youthful, to help refresh the skin, to help even just clean out the pores and get a bit of a restart. Beauticians can definitely improve someone's short-term health of their skin and appearance, but in the long term, these treatments are reasonably expensive and they're going to be something that really doesn't make much change. The overall genetic predisposing factors and of course the effects of aging due to environment, radiation, cosmic rays and similar. The next step after the beautician would probably be to look at minimally invasive techniques like microneedling, PRP, filler, Botox, semi-permanent treatments. Things that are injection or are otherwise minimally invasive are probably going to be your choice here. The reason being that if you want a treatment, you maybe don't want to have scars, you don't want to go under the knife as it were, then you want to look at Botox, which helps relax the muscles. So if you can't flex, you're not going to develop wrinkles as quickly. Also, if you have existing wrinkles and you don't move the forehead or the muscles, you're going to find those wrinkles start to fade over time. Now, they will not go completely away, but it will be a lot less obvious. And that can be a very youth-enhancing appearance for patients. The next step after Botox would probably be to think about fillers. Fillers are, as the name suggests, something that fills in the connective tissue behind the skin, and they can fill up areas where there is volume loss. Some people like to think of it as filling up the sag of the skin as well. I'm not entirely sure if that's the most appropriate way to think of it, because usually you're adding extra volume to places that maybe previously didn't have. But it also gives people a very easy way to accentuate, for example, the chin, the cheeks, and some of the higher areas if you want to add more height to certain areas, so you can get higher cheekbones and maybe more prominent jaw lines. After filler, the next type of intervention that we probably should think about then would be things like permanent interventions, so-called. Now, nothing in the world is really permanent, but you can get implants, surgical treatments, so liposuction, liposculpting, where you try to take fat and give a better form. In many cases, women will have fat removed from one area to try and enhance the areas around. And of course, we have the implantation of prosthetic implants. Things like breast implants, butt lifts, even abdominal implants are now becoming more and more common. These are usually silicone based, and the risk with those is that once you have them implanted, if something goes wrong, you're going to need new surgery to remove them. Also, there have been some reported cases of cancers and other complications due to faulty manufactured goods. On the other hand, when one gets those treatments, they are done, and in many ways, you hope never to have to see the surgeon again, at least not for maybe 10 or 15 years. Finally then, where do regenerative treatments fit into this tree? Well, PRP is a minimally invasive treatment. That's platelet-rich plasma. You take the blood, centrifuge it down, and from the blood you take the platelets, and you can inject those subcutaneously really anywhere. But in particular, they're used for hair loss for men, and they're also used to enhance the skin, make a youthful appearance, to try and also give and fill out and flesh out the skin. You can find an anti-aging effect from these, as they actually increase stem cell growth underneath the skin. So subdermal tissues can be stimulated by PRP, where the stem cells themselves actually get woken up and told to get to work because the platelets say that there's an injury. There is of course no injury, but that simulated injury causes immune system response, and you will actually increase the collagen, and you can get a thickening, a filling of the subcutaneous tissue. It probably won't be anywhere near as pronounced as a filler treatment itself. It may cause some gradual reduction in wrinkles or atrophy. It may also actually cause a youthful appearance and that glowing skin we like to talk about. Stem cells then are sometimes used in regenerative procedures for cosmetics and for aesthetics. The reason being that you can take the stem cells from the fatty tissue, centrifuge those down, remove them and mix them with PRP, and in that case you would actually be adding building blocks to try and build even more tissue. This is something you could do, for example, for breast enhancement, buttock lift, maybe even to get rid of stretch marks or scars, and in some cases people even have used it to try and help prevent or treat cellulite. PRP can be used in many cases if it's given in repeated injections to similar effect, and I'm not quite sure as of right now where the economy is in terms of getting a stem cell, which is quite expensive, versus getting multiple PRPs, which would be a good deal cheaper. Probably, my gut feeling says that PRP repeated would be worthwhile and really worth doing, but I can't say for definite because I don't think there is good research on that. I'll take a look for papers and we'll maybe have a different video. Thanks for watching and joining me in this video. I hope you learned something, and if you did, please let me know. Leave us a like or a subscribe. Also, if you have any questions you'd like me to answer, I do read the comments, so leave a comment down below and I will try and get to your topic as soon as I can. Have a nice day, and I'll see you in the next one.